All right, everyone, welcome back to our channel. We do hope that you've learned one or two things from our previous videos. We want to appreciate you for following us. Don't forget to subscribe to our channel. Then make sure you give us your feedback in the comment section. And of course, we want you to like the video and share it to your family and friends and relatives. We want everyone to learn together with us so that we can also learn from you. In our previous video, we talked about safe period for pregnancy, and of course what we meant by safe period in for pregnancy in that video was a way of increasing chances of getting pregnancy. So we know that a lot of people are looking for this. They are married for some months, year or years, and they are still yet to be able to get pregnant. Of course, there are little things that we can do, and we believe that when you do some little things, just like that man said in his book, Atomic Habit, that when you do some little things that, of course, that are right, they gather up and they give you a kind of very huge result. So we believe that if we try to practice what we mentioned in that video, we'll be able to achieve the success. And today we want to also look at safe period for pregnancy as well. But today, what do we mean by the safe period for pregnancy? Unlike in the last video where we were talking about how to increase the chances of having or achieving pregnancy, today the safe period for pregnancy that we'll be talking about is contraceptive. So which means a way of avoiding pregnancy. Of course, we know that there is this particular campaign of family planning or child spacing. And of course, it is not everyone who could even really achieve this, because there are a lot of methods of doing this. There are the use of condom both for male and female. There is use of copper T. There is use of contraceptive pills or drugs or injection. And of course, there is even one that is inserted beneath the skin. And we know that is not everybody who can achieve this method. So today we want to talk about the natural way by which a woman could prevent occurrence of pregnancy. So unlike in our last video where we talk about how a woman can increase the chances of getting pregnancy, so today we want to look at how woman can naturally avoid having pregnancy or reduce the chances of getting pregnant without using all these contraceptive drugs or means which we have just rightly mentioned. So let's look at how this could be achieved. Just like in our last video where we're talking about ovarian cycle and menstrual cycle, that is what we also want to target for today. So we know that the menstrual cycle, the first day of seeing the blood, the menstrual blood, that is the first day of the menstrual cycle. And like I said, we'll be just like in the last video, we'll be targeting a woman who has a calendar of 28 or 32 days. Maybe 28, 29, 30, 31, or 32 days. So for this particular person, the ovarian cycle also is going on as the menstrual cycle is going on. But what usually happens is on the day 14 of the menstrual cycle, of course, there is what is called ovulation. This ovulation just means the woman releases her egg. That is just the meaning of ovulation. So I will not be bothering you with the terminologies or the embryological jargons, but we just talk about what happened, and that is just release of egg by this woman. And this egg will be waiting to be fertilized by the man's spermatozoa. So what do we do? That is what happened on day 14. Let's say a woman start bleeding today and she starts taking down her calendar. So on day 14, there is going to be ovulation. Of course, there may be differences. It might not be exactly on day 14, because what happens is the ovulation doesn't usually correlate with the beginning of the menstrual cycle, but the end of the menstrual cycle. So which means whenever a woman ovulates, then the next 14 days, she's going to end her menstrual cycle. So of course, for those who have higher number of days, those who have more than 28 to 30, 32, some even have as much as 38 days. So these people, it means they do not ovulate on day 14. That is what happened. So in this video, we'll be targeting those who have a calendar of 28 to about 32 days and whose calendar is regular. Not that they will have 28 this month and next month they have 35. So no, we want to talk about those who have regular calendar between 28 and 32 days. So what happens is when there is ovulation, which we of course target that day 14. And before I continue, there's another method that I would like to mention, and that is just the basal body temperature method. So the woman is going to take down her body temperature daily. So this is what happened. The first day of her menstruation, when she see the blood, she will take her body temperature and note it down. So the next day, which is day 2, she will take her body temperature as well. Day 3, day 4. So what is expected is that the body temperature will rise as the number of days is increasing. Then it will get to a particular a particular day that this temperature will start reducing, decreasing. So when this temperature start decreasing, there will be a particular point where this temperature will decrease to a certain temperature point where it will start elevating again. So this particular temperature where the body decrease to a point before it starts elevating the next day, that day is when the woman ovulates. So ovulation occur when the woman has the least body temperature within that menstrual cycle. So when you target your calendar and you know the number of days and you are targeting day 14 and you're also using this temperature to back it up, you will be able to target this particular day that you ovulate. All right, we've been able to explain how the woman can calculate her menstrual cycle. That the very first day that she see her menstrual blood, that is the day 1 of her menstrual cycle. And of course, we explained using the temperature, checking temperature every morning, that with this, the woman will be able to predict when she's going to ovulate. But now we are not really targeting the ovulation. So we explained in our last video when we're talking about the safe period for increasing chances of getting pregnant that the woman should try to increase having sexual intercourse between day 18 and day 19. So it means for someone who doesn't want to get pregnant, can have intercourse from day 1 to day 7, and of course from day 20 to the end of our calendar. But there is something when we are talking about day 1 to day 7. Don't forget that between day 1 and day 7, this woman is menstruating. Probably day 1 to day 3, or for someone who have 5 days calendar, day 1 to day 5. And there is a particular report that having sexual intercourse when a woman is menstruating can increase the chances of both the male and female contracting sexually transmitted infections. So in this video, we are going to advise and recommend that you stay away from this. So meaning that when you subtract these days and also at the end of the days which we mentioned earlier, which is from day 20 to the end of the menstrual cycle calendar, then unprotected sexual intercourse is not expected to give or to result into pregnancy. This is the end of our discussion as far as the protection of getting pregnant is concerned. And we do hope that you've learned 1 or 2 things from this video. Don't forget to subscribe to our channel. Just click the subscribe button and click the notification bell so that when next we upload a video, you'll be able to benefit from it. And don't forget, we want to have your feedback in the comment section. We also want to learn from you. And don't forget to share this video so that your family, friends, and relatives can benefit from the video. Thank you so much. Bye for now.